Welcome to our second part in this series on yoga, mindfulness, and body-based interventions. We're going to be looking at our next topic in the series. We're going to be looking today at an introduction to trauma. So we're really going to be looking at what trauma is and how it works within the body. So I'm going to go ahead and share our PowerPoint so that we can begin looking at the series. Okay, as I said again, we're looking at part 2. We're going to start looking at our introduction to trauma. So before I do this, I always like to give a little trigger warning. So we're not going to be talking a lot about specific situations of trauma, but just because we're talking about trauma in general, sometimes that can cause distress in a person who may have experienced trauma in their own life. So if at any point you need to take a break, I encourage you to do so. Do whatever it is that you need to do to take care of yourself. That might mean you pause the video, you come back to it later after you take a walk around the room, around the block if it's nice outside. Maybe you distract yourself just a little bit by doodling or playing with fidget toys. Maybe you take a couple of those slow, deep breaths and you use the breath to work with your nervous system. Lots of different options, but again, just take care of yourself as you go through this whole series if anything does come up for you. Okay, so I'd like to start each of our series with one of the activities that you can do as a part of this umbrella of body-based interventions. So last time we did that 3-part breath. This time we're going to do a short body scan. So you might again take a position where your feet are on the floor and your spine is nice and tall. This is often done lying down. Because we're doing a video, we may not choose to do that, but whatever works for you. If it's comfortable, either gaze down away from the screen or close your eyes, whatever feels best to you. And then begin to bring your awareness to your body. Start by noticing your entire body, your whole body sitting on the chair or lying on the floor. And then bring your awareness all the way down to your feet and notice your toes. If you can, see if you can notice your toes without moving them. And then bring awareness into your foot. Notice the top of your foot, the bottom of your foot, your ankles. Notice both feet. Continue to draw your awareness slowly up your body. Notice the backs of your lower legs, your calves, the front, your shins. Notice your knees. Notice the backs of your thighs, the front of your thighs. And then notice both legs, your entire lower half of your body. Notice your legs. Bring your awareness up into your hips. Notice your right hip, your left hip. Notice your seat connecting to the floor or the chair. And continue up. Notice your lower belly, your abdomen. Notice the sides of your body. Notice your chest. Become aware of your collarbones. And notice your shoulders. Notice the back of your torso, your lower spine, middle spine, shoulder blades, and the backs of your shoulder. Draw your awareness down your arms. Notice your upper arms, your elbows, lower arms, wrists, palms, the backs of your hands, and notice your fingers. Notice your whole torso and your arms together. Draw that awareness farther up. Notice your neck, the back of your neck, the front of your neck. Notice your face, your cheeks, lips, chin, ears, eyes, forehead, the back of your head, the top of your head. Notice your entire neck and head. And then once again, bring awareness to your entire body. Notice your whole body. Become aware of your whole body. As you're ready, if your eyes are closed, begin to blink them open. Take note of anything that may have shifted during your body scan. And then we'll continue with the rest of our discussion on trauma. So the first question I always like to ask is, what is trauma? So people have lots of different definitions. Some of the formal definitions I don't think really encompass what we need to pay attention to in trauma. So take a moment and just consider, what is trauma? And here's our formal definition coming from the American Psychological Association. Trauma is an emotional response to a terrible event. This could be something like an accident, an assault, or a natural disaster. So we're specifically in this definition linking trauma to a terrible, overwhelming kind of event. And these are things that anyone would say, yes, that's traumatic. That's a bad thing that would happen. Right after the event, we usually see a lot of shock and denial that this has happened. Very typical. The longer term reactions are what becomes more of an issue. So the first 3 days are kind of like, we expect there to be a lot of emotional instability. We expect there to be some things that might be going on that's a little different. That's very normal in the first 3 days. Longer term, and now we're starting to talk about 3 months or longer, we're starting to see a continuation in some people where there's unpredictable emotions. Maybe we're seeing some flashbacks where people are thinking about and feeling like that event is happening in this present moment. They can't even distinguish between right now and when that event happened. This could cause relationship issues. Sometimes there's a lot of physical symptoms, such as headaches or nausea. These feelings are very normal, but when it gets to the point where this has been going on for 3 months or longer, that's when we want to start looking at some clinical attention. And we're looking at lots of different ways in which that attention might take place. So we want people to be able to integrate and move on with their lives. So it can be really important to look at not just the event. So in our formal definition, our American Psychological Association, they look at the event and they say, okay, this event is obviously traumatic. This car accident, this hurricane that demolished your home, whatever it is, that's traumatic. But what we're starting to find out is that it's really not as important to look at the event. It is much more important to look at how the body reacts to the event. So if we're looking at, do you have trauma from a specific situation, the event may or may not be the important thing. You might have been in a terrible car accident, but you've had a great social support, you have good coping skills, you don't end up with long-term trauma symptoms. So we're looking at the body's reaction, how the nervous system is changing and doing things differently because of this event. In general, in the moment of that event, our body moves into flight, fright, freeze, fight, freeze, or fold. So our body is preparing to do whatever it needs to do in this one exact moment so that it can survive. It's not looking at long-term, we need to take care of ourselves. It's looking at what do we need right now to get through this. And we're going to talk about how this changes things. So in our survival systems, one of the things that's really important to know is that we're getting into our nervous system in a different way. Trauma is stored in the amygdala, kind of in the middle back part of the brain. And that part of the brain creates these mental models of danger or safety. And this is very closely linked to our sympathetic nervous system. Our sympathetic nervous system is the part of your brain that says, something's happening, we need to get ready to take care of this right now. And we'll look in just a moment about what that actually does. But when we're looking at that exact moment of trauma, there's two different things that our brain, okay, let's back up a little bit. Our brain is going to make a decision based on this lower amygdala brainstem area that is going to best take care of you and help you survive in the moment. So this means that we're actually going through the thalamus that's communicating to the amygdala. That's looking at the immediate response, that fear and arousal in the nervous system. Sometimes we call this the reptilian brain. It's developed earlier and it makes that decision quickly. So it's not coming up to the higher levels of consciousness. If we're looking at decisions we make with what we call the high road, that's our neurocortex. That's where we take some time to assess, understand what's happening around us, and then make a decision. In a life or death situation, we don't have time to get up to this thinking part of the brain. So that low road, that thalamus, that amygdala, that sympathetic nervous system is going to make that decision without going to the higher road. What this means is that in the time of a trauma, we do not consciously decide what we're going to do. We have no choice in that reaction. And this is really, really important for survivors of trauma. To understand, you did not make the choice of what you did when that situation happened. Because a lot of people will hold on to shame, feeling like they should have made a different decision. They should have fought harder, they should have run away, whatever it is. But in that particular point in time, you did not have control over the higher thinking part of your brain. You did not get to make that decision. So it's really important to understand for anyone who's gone through trauma, those life or death situations, you do not get to decide. We are going through the low road, the reptilian brain. Our bodies are deciding for us. We are not making that conscious decision. And again, this is all related to the sympathetic nervous system. We're going to talk more about that in just a moment, but I think it's also important, we're going to get to this a little bit when we talk about stress, to talk about what we call the T's. So, big T's versus small T's. What does that mean? Big T traumas are those things that everyone says, yes, that's traumatic. Yes, that's a problem. Yes, that's something that should impact you. That can be a one-time event like that car accident. It can be long-term life situations. So that could be if you grew up in a home that was very neglectful. That can be a big T trauma. And most people would say, yes, that makes sense. That's traumatic. Small T's are different. And the important thing with small T's is that we don't always know what is causing the body to have that sympathetic nervous system reaction, because we don't always know when another person's body feels threatened. So a great example of this, we see this written about a little bit in Bessel van der Kolk's book, The Body Keeps the Score, but I've also seen this with students in my own classroom. So if you have a young child, 3 to 5-year-old, that goes into the hospital for something that you think is very normal, not really a problem. Maybe they're having their tonsils out. You think, no problem, doctors are taking good care of them. This is not a risky situation, no trauma. But to that child, they're in a different situation. They don't understand what's happening to them because they don't have that cognitive ability yet. They don't, they're scared because strange noises and things are happening around them. Their parents are maybe not always there with them to provide that security. Maybe they're put to sleep for their operation and they wake up and they don't understand what's happening and they're terrified. Their body is reacting as if this is a life-threatening situation, as if this was a big T trauma. Not something we would say is traumatic, but something that can be very traumatic for people. It's based on their not being able to understand what's happening in that situation. So if the body reacts as if this was a traumatic situation, our sympathetic nervous system is turned on into overtime and maybe we have trouble shutting that off, that can cause the same kinds of reactions to the bigger T traumas. So this can actually become diagnosable if we're having so much trouble adjusting to this small T situation that our bodies can't adjust and get back into the healthy part of the nervous system, the rest and digest part of the nervous system, then this actually could even become diagnosable. And I've had students in my classroom say, yes, I had a child that went into the hospital for this event. We thought it was no big deal. We don't understand why my child is acting differently now. Nothing major took place. Why are there different behaviors? Why is there that fear there? So this is something that we really need to look at a little bit more closely. So basically, when our body goes through trauma, we have 3 things that are taking place, 3 things that your body is trying to do. So we have that hyperarousal. We're constantly in that high alert, always looking for that danger going on around us. We have intrusion, so reliving the events as if they're happening right now. That's that flashback kind of situation. It can also happen in nightmares. That is your brain trying to make sense of that memory. And then constriction, there's avoidance of the things that remind you of the trauma. So people start to kind of narrow down what they do. So maybe one time they go to this place and something triggers them and reminds them of this event. So they're not going to go there anymore. Then they go to another place, same thing happens. They limit what they can do because of that. They're trying to limit the amount of time that they're triggered. So when you look at these are actually our 3 categories of symptoms in post-traumatic stress disorder. So 3 ways that our body is attempting to deal with that trauma. So we've kind of briefly mentioned our nervous system, but we need to look a little bit about what's going on with the nervous system because this is really, really important. So overall, we have our autonomic nervous system. This is a part of our nervous system that regulates all of our involuntary processes. So this is all the stuff that keeps us alive and going throughout the day. there's two branches for our autonomic nervous system. We have the sympathetic nervous system and the parasympathetic nervous system. When we have that survival situation, our bodies will move into, typically, and I'll go into this in a different slide, a different part. Part 3, we're going to talk a little bit about a complicating factor for this. In general, when there's something that threatens us, we move into our sympathetic nervous system. When we're in this system, our bodies are preparing to keep us alive in that present moment. So our heart rate is going to go up and our breath rate is going to go up. That's going to get the oxygen into the rest of our body so that we can be prepared to run, to fight, to do whatever we need to do. Our pupils will expand. That helps us see what's going around better. Your senses might be heightened. So we have these things that are happening to prepare us for right now. However, in general, when we are in these situations, our parasympathetic system is kind of going offline. So all the stuff that keeps you alive and healthy for the long term says, we don't need this right now. We got to get through this first moment. We got to stay alive right now. So our immune system will go offline. Our digestive system is going to slow down. All of that rest and digest stuff that doesn't seem necessary in that present moment is going to kind of take a time out. That's okay if that only happens in that 30 seconds when the car is coming towards you and you think it might hit you. You can shift into the sympathetic nervous system and go back to the parasympathetic. What happens is part of that sympathetic nervous system is also releasing different hormones into our body to make all of these things happen. So we're releasing adrenaline, we're releasing cortisol. But what happens is that doesn't get shut off all the time. So it keeps going, especially with the cortisol. We're not getting that cutoff that tells us, okay, now we can go back to our parasympathetic. So we kind of get stuck in our sympathetic nervous system. And this is when we have some of those long-term issues. This is when we have issues with post-traumatic stress disorder, with immunity, with digestion. We're going to look at a lot of this in the next part, part 3, when we're looking at the vagus nerve. But we have all of these issues going on that were great in the moment. We needed it at that moment. These are not bad things to have happen. But we also need to be able to go back to the parasympathetic nervous system. And one last note, it's really important to know this because you might say, I have no trauma in my life. Nothing bad has ever happened to me that counts as a trauma. But our bodies will see high stress situations in the same way that they see trauma. So if you have a big presentation at work, and you're afraid if you don't do well in this presentation, your boss is going to fire you, you're not going to have a job, you'll have no income, so now you can't pay your bills, so now you're going to lose your house and your family's going to be homeless, right? This is how some people's brains think. If you're feeling that kind of stress, your body is going to go into that same sympathetic nervous system overload, just like any other survival situation. And for many, many people, we have a lot of time and pressure in our jobs that puts us more and more into that sympathetic nervous system. We are always actively prepared for something to threaten us. At school, at work, whatever it might be, we're having that excessive worry and stress about our long-term capacity. So this means we're getting those hormones, we're getting everything into that sympathetic nervous system, and we're not getting into our parasympathetic nervous system. It's not working up to its capacity that it needs to. So often what happens is people with a lot of stress start to become ill. Their immune system is not strong. It's not taking care of you. Maybe there's digestive issues. Maybe you can't sleep at night. All of these things are taking place because that stress is causing your body to go into that parasympathetic overload. So, linking all this back to our yoga, mindfulness, and body-based interventions, we are using these different activities to shift us back into our parasympathetic nervous system. So we talked in our first part of this series about how we're letting things slow down. We're doing these activities to increase the physical awareness in our body that will allow us to have more of awareness of how we feel physically and emotionally. And by slowing that down, our bodies are able to find that there's not a threat in this moment. We can shift back to our parasympathetic system. And now our bodies have the chance to do the healing, that long-term digestion and rest, all of those things that we need for long-term good health. So we're going to be improving our physical and mental health by doing these activities that shift us back into our parasympathetic nervous system. So that is our discussion on our introduction to trauma. Lots of things to know. You might take some time to do a little extra research. There's a million fabulous videos about this online. This is just one that I'm creating for you. So hopefully you learned a little bit of something here. And in the next part, we're going to take a look at the vagus nerve and a little bit more neurobiology and how that plays its part in this series of events and how we can use that through body-based interventions. Thank you for joining me. See you next time.